silver seal, so that goes against the patient's skin. A lot of times I'll put lotion because they're wearing this for so long that their skin does tend to dry out. And they're usually have drier skin anyway just because of having the lymphedema. So depending on the size of the leg and how much I'm trying to reduce is dependent on how many of these bandages I'm going to use. So Juliana's little, so I definitely would use the 6 centimeter at her foot and ankle, but sometimes the patients have a really big foot or it's really, really swollen, and then I tend to start with an 8. But I tend to use 3 different sizes, or at least 1 small one and then 2 bigger ones. So this one is I think this is a 10, looks like a 10. And then this one is a 12. I don't ever really use a 12 unless the person is giant. So keep that in mind. So when I'm wrapping them, I try to wrap them in this position, or they can just be sitting on the edge of the bed if you're comfortable sitting on the floor. But I want them to keep their foot in that 90-degree angle because obviously when they walk, you want it to be already done for that. So I start like a snail. I start at the base of the foot, and I'm going to go around. Typically I'll go around like 2 or 3 times. And then I'm going to go and make like a stirrup and then back down. So the whole purpose of this first small bandage is to cover the foot and the ankle. So I never want to go up higher with it, but I also want to make sure that I don't have any gaps. So I'm looking to see that I don't have any openings of this tan bandage like at the heel or something like that. So I'm just going to kind of make my way around. Now it's like when you're doing athletic taping, if anyone's done that, you want to avoid wrinkles as much as possible because that's going to cause blisters. Okay, and then the whole idea of all of these bandages is that you want to have a good compression gradient. So typically the tightest one is going to be more distally because you're trying to get I didn't get any tape. Can you throw me the tape? You want it to be tighter distally so that the fluid is pushed up towards the trunk versus down into the toes. Tight?
Yeah.
Okay. So then the next one, and what you always want to do with every subsequent bandage is you want to make sure that you're covering the end of the last one. So here I'm just going to kind of start around in that area and make sure I cover the tail of it. So now this one I typically will just spiral up. Gosh, you're so skinny.
How many going to the
So typically this bandage will last not quite as far up as this, but her leg is really small, so I'm overlapping more than I would need to with somebody that has a bigger leg. So until you get the hang of it, you may have to try it a couple times. But if I have any leftover bandage, typically you will not unless the person is very thin. If you do have any, what you don't want to cinch this as tight as the rest of it, because otherwise then it causes a tighter region at the top of the calf, which is defeating the entire purpose here. Okay, and then the last one, which is going to be hard with this big bandage, but so the last one I'm doing what's called a herringbone. So you want kind of a V pattern with how the bandage goes. So I start above the ankle and I come make the V. So Erin, you might want to come closer to see. And so I'm angling my bandage so that it's not straight across, but it's down. So you can see I start to make these little teepees. And it doesn't have to be perfect, but as best as you can line, even this isn't quite doing that, but as best as you can line these V's up, the better. And then same thing, I get to the top, and I'm just going to loosely put that around because I have a little bit of extra. And then your last layer is the tuba grip. So the tuba grip is just that tubular stocking. This does have elasticity in it versus the silver seal. This one is to help with a little bit more compression, but it also holds it all in. So if she had a ton of swelling in her leg, as tight as I wrap these, the swelling is going to come down. That's the idea, but then these will just start to like droop and kind of slide down her leg. So this kind of holds it all in. So there's different sizes this way, and they come in a letter size. So A is like little skinny tubular one, and then it goes, you know, down the alphabet to bigger ones. So this one is probably I would say a little too big for Juliana. But basically, I'm not going to put it on you right now, but basically you would cut it to length for the person, and you would put it over top of all of this stuff. And that's it.